From the News Channel 5 Network, this is Morning Line with Nick Barris.
Good morning, everyone. Thanks for joining us on Morning Line. Nick Barris with you on this Thursday. We're coming to you live today. This is a live program, and I appreciate you joining us on the Plus. We are also right now streaming live on Facebook at News Channel 5 Nashville. If you want to jump on there or let someone know who can't catch us on the Plus that they can catch this program right now streaming live on Facebook, and invite your questions or comments there, as well as you'll be able to call into the show. And we're streaming live this morning because it's a chance for you to ask a lot of questions about the very latest of what we're seeing with regard to COVID-19 and some of the things about vaccines, back to school, what we're seeing about some new positive news, all of that, some other developments as well on who's more susceptible and maybe who has a better chance of standing up to the illness. And you may recognize the individual I'm going to introduce to you because he's been in the media a lot and involved at the forefront, I think, at trying to answer questions for people along the way. And that is Dr. David Aronoff joining us this morning. He's with Vanderbilt, Director of the Division of Infectious Diseases there. And it's a pleasure to have you, Professor. Thank you for joining us this morning.
Nick, thank you so much for having me on. It's a delight.
Good to have you on. Well, listen, we'll get some phone calls, I'm sure, and some comments as well for those following us right now on Facebook. But let's just start at the beginning here. Some of the latest news appears, at least here in the metro area, to be some positive developments with regard to the counts. We're certainly not out of the woods, but things have gotten better. Want your take on what you've seen over the past few days and what you think is the cause of some of what we're seeing.
Yeah, thank you. I think it's time for some good news with this pandemic. We've been living with it in Tennessee since March. And really what we saw in late June and early July was an escalation of disease activity in the area. And more recently, in the last week or so, we've seen a de-escalation of disease activity. We've actually seen the number of new cases of COVID-19 that are diagnosed every day starting to fall. And I think that's really encouraging. That's not only been the case here in Davidson County, but we're seeing similar trends statewide. The state numbers are starting to really look more downturning, which I think is very promising.
And do you attribute that to a variety of factors? I imagine, the mask wearing, social distancing, more people may be playing a part of that. What are the factors here as to why we see maybe the beginning of a trend going the other direction again?
Yeah, I think there's probably multiple reasons for that. Recall that coming out of Memorial Day and getting through June into good weather and heading towards 4th of July, there was a lot more activity. People were getting back together. There were looser restrictions around social distancing, looser restrictions around mask wearing. And then really through July, we started to see mask mandates in certain counties, for example. We started to see more enforcement of groups gathering without masks, particularly in indoor venues. And we even saw here in Davidson County moving from a phase 3 of opening back to a modified phase 2. And I really think that all of that has started to add up to seeing case counts fall. So that's been a mixture of people maybe going out less, people respecting distance between one another more, certainly more mask wearing. One thing I've noticed is that it's starting to look less strange to see people in public wearing masks, which of course back in February would have been really strange. And now that's become the norm. And in some areas, particularly grocery stores and other places, if we see people without masks, they tend to be the ones that stick out. So I think all of that, particularly the public's buy-in on the kinds of things we need to do to get back down to a good baseline, to be able to safely open schools. I think we're seeing these efforts begin to pay off.
All right, just a reminder again for those joining us right now, that's Morning Line. We're on News Channel 5 Plus. We're also streaming on Facebook. A lot of people following there. This is Dr. David Aronoff from over at Vanderbilt, Director of the Division of Infectious Diseases, and at the forefront much of what's going on with regard to COVID-19. So if you have questions or comments, go ahead and send them on Facebook, and I'll share them with him as well, or you can call in, the number up there on the screen. Doctor, let me ask you this then. One other thing, as we see some of this positive news coming about, that that's coinciding with the fact that many youngsters now heading back to school, and parents in some areas have a choice between virtual learning and back in the classroom, and they're trying to do everything they can to make it safe to return to in-person classes. And this can go all the way up to higher education at the college level too. They've got a balancing act. What is your take about this in terms of now seeing maybe these in-person classes coming back and how this might play out?
Well, I think across the state, we're seeing sort of a series of experiments going on, similar to the kinds of experiments we saw going on when businesses started to reopen. As we moved from phase 1 to phase 2 to phase 3, we're seeing more people getting together in schools. And that's a mixture of children and adults, and an age range of children. And of course, predictably, as we still have disease activity that's fairly high across the state, even though it's heading downward, we're starting to see some cases presented in either students or faculty or staff or other adults who work with the school systems. But one thing I think that's important is that most of the schools that I'm aware of who are open have baked in some contingency plans of what to do when there's cases that are arising at the school. Some are shutting certain class areas or having the whole school go back towards an online learning. But we're, I think, in a position where we're learning a lot from these early openings.
As far as children are concerned, just want to clarify on this. There does appear to be some indication that maybe children are a little bit more able to be resistant to a degree to this virus. But I mean, it's very obvious, is it not, that children can be harmed by this as well? They're not invincible to the coronavirus.
Yeah, Nick, I think that's a really good question and a really good point to bring up. So the first thing is that human beings of all ages can get infected with the SARS-CoV-2 virus. There's no age group or type of person that is completely immune to getting infected. But what we're clearly seeing across the age range of people is that older adults are much more likely to get very sick with COVID-19 and to end up in the hospital or to die from this infection, much more so than children. So even though children can be infected and they can transmit the virus to other children or transmit the virus to adults, they really do tend to be protected from getting very sick. Now, we do see children that end up in the hospital with COVID-19, and we do see children that get what's been called a multi-system inflammatory condition. It's a rare condition, but when you have enough children infected, they can get that. But all things considered, children should be viewed as potential victims of COVID-19. They're people who can transmit the virus, but they also are much less likely to come down with severe symptoms.
Wanted to ask you about this other encouraging development. Dr. Hildreth over at Meharry was talking a bit about this yesterday, and I've seen some reports. The public may be taking notice that they've gone back, and as we learn more about this virus, they're looking at other coronaviruses, which, as you know, can be related to the common cold and the like. And people that maybe had a lot of head colds and common colds in the past, they think there may be a possible link between that and having a better resistance to COVID-19 if you're exposed to it now, if you've been through those others. Have you seen some of those new reports out there where they're trying to see if maybe that helps in some way?
Yeah, again, that's an important point. One of the key things is we don't really know exactly why some people get so sick with COVID-19 or get symptoms and other people don't, even though they otherwise seem fairly similar. So even though people in their 60s are more likely to get very sick with COVID-19, there are people in their 60s that don't get very sick with it. And the question is, what's the difference? Why is that? And one possibility that I think you're mentioning is that this coronavirus that causes COVID-19 is a relative of the coronaviruses that have been in human populations for centuries, that cause things like seasonal colds. And there's some evidence that there could be some immune crosstalk. And if I'm immune to a common cold virus, I may have some protection against SARS-CoV-2. But I think that that's likely to be a minority population. And it's important to remember that for a lot of these coronaviruses that cause the common colds, that immunity doesn't last for very long. And so we tend to be able to get even the same coronavirus infection seasonally over and over.
All right, listen, let's take a quick phone call, and I've got several questions coming in on Facebook. I'll get to you after we come back from a break, but let's squeeze in Linda before we take our first break. Linda, good morning. Do you have a question for Dr. Aronoff? Are you there, Linda?
Are you
Yeah, go ahead.
Oh, yeah, I didn't hear my name.
That's all right.
Listen, I was wanting to ask him, like, when they're going back to school, a lot of places are requiring masks and, things like that and sitting far apart. What if they're private schools and they don't require anything and they're letting them sit, next to each other? I mean, period, arm to arm. So what would you do?
Okay, Doctor, we have heard of some parents who were upset or disappointed that the school was doing, the online teaching and have chosen to pull their kids from the public school where that was happening and enroll them in a private school that was having in-person classes. And I assume many of those schools, if they're having in-person classes too, are trying to social distance and wear masks. But what about the scenario she described? Would that be a concern?
Yeah, Linda, thank you very much for your question. That's a really good one. I think regardless of venue, whether it's a school or a business, a grocery store, or whatever, when people who don't live together are coming together during this pandemic, there's some fundamental things that we know help to limit the risk that transmission is going to occur. One is creating distance between different people. And the other is doing things to block the dispersal of our breath across the room or in a cloud around us, and that's by wearing cloth masks. In addition to taking good care of our hands so that we have clean hands in case we touch our eyes, nose, or mouth, we won't inoculate ourselves with the virus. So I definitely favor if schools, if and when schools are bringing students and adults back into the building, that there really should be attention paid to those fundamentals of prevention of distance, hand hygiene, and wearing masks when possible. Sometimes very young children can't wear masks, but in general, elementary children and middle schoolers and high schoolers can. So I would much more favor the situation you raised of people engaging in those activities rather than not.
Listen, we have to take a break. When we come back, we'll get to some of the comments online. We're also going to address the issue with the doctor about when and how we move forward in terms of some of the businesses that have had to shut down to some degree can reopen again, which, again, we cannot forget that side of it. You have to balance the public safety, which is number one, with the fact that many people are going through financial and economic hardship, and that's awful for them, and they need to know, is there a light at the end of the tunnel? Let's take a break, and we'll come back with more on that and more of your questions for Dr. Aronoff over at Vanderbilt right after this.